Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McRae.
Tracy, between 50 and 100,000 Americans die each year of vaccine-preventable diseases, like the flu, pneumonia, hepatitis C, diseases that they likely wouldn't have died of had they gotten vaccinated. For example, less than 45% of adults in this country actually get the flu vaccine. And there are several other vaccines that adults should be getting.
Should be getting. The recommended adult immunization schedule has received a significant makeover for 2019. And the number of vaccines that adults should be getting will likely surprise a lot of people. Joining us to talk about adult vaccines and to give us an update on the flu season and yet another outbreak. And the new flu vaccine, too, that's in development. Vaccine researcher and infectious disease specialist, Dr. Greg Poland. Welcome back to the program, Dr. Poland.
Thank you. Good to be here.
Well, Dr. Poland, we certainly want to concentrate on vaccinations for adults because we know that there are a lot of vaccines that they should be getting and a lot of them aren't. But talk to us a little bit about this outbreak of vaccine-preventable diseases around the country.
Yeah, I mean, when you think about it right now, we have an outbreak of influenza, as we do most years. This is a very serious year, as was last year. We have pertussis every time during this time of the year. Whooping cough. We have hepatitis A outbreaks. We have measles outbreaks, and we have mumps outbreaks. Every one of those 5 diseases we have safe and effective vaccines for.
Do we know the mumps outbreak is in, I think, in the Philadelphia area? And I was just looking at the schedule of recommended vaccinations. And MMR, measles, mumps, rubella, it says 1 or 2 doses, depending on the indication, if born in 1957 or later.
Right.
Does that mean that if you were born in 1957 or after that, you need 2?
Correct. You and I had the disease. People that came after us and yet are older, not in college, got 1 dose in childhood. The kids that are in college now should have had 2 doses of vaccine.
So we know that the outbreak, the measles outbreaks around the country, are related to the fact that these kids didn't get vaccinated.
Correct.
Do you think that's the same
majority.
thing with regard to the mumps outbreak?
One thing that's a little different about mumps is, I do think that many of them don't have documentation of 2 doses. But even if they do, of those 3 diseases you mentioned, mumps is the one that wanes with time.
Oh, the immunity wanes.
Yeah. And so what happens is you have waning immunity, and then you bring thousands of kids from all over the world together in one place. And boom, you have these outbreaks.
But just like measles, I mean, mumps can be a serious disease, right?
Yes.
Can't you get encephalitis from
absolutely
inflammation of
deafness,
the
sterility? I mean, it's nothing to just pass off as a benign disease.
We're lucky. We had it when we did and didn't have any of the complications.
Yeah.
Well, let's talk about this updated table. I mean, we actually, Dr. Shives printed it out for me. It's a whole list for adults. I'm so used to the well child visits and making sure that my kids have got their shots. Now I've got one for me.
Indeed. In fact, it's personalized in the sense of it not only says what we should get when, but by medical condition or context.
So it says that if you have a certain chronic disease, then you should get this vaccine.
Right, or in some cases should not get a certain type of vaccine. But the idea here, and Tracy, you set it up just right, we do a good job overall with childhood immunization because that's pasted in the exam room of every pediatrician and family doctor. We need to do the same thing in medical care for adults.
What has changed with this from 10 years ago?
From 10 years ago, a number of new vaccines. So one would be a new shingles vaccine that is superior to the one that we had previously, a new 2-dose vaccine.
That's Shingrix.
Okay. We have a new hepatitis B vaccine that didn't work very well in adults and took 3 or more doses. Now we have one that works in virtually everybody, 2 doses 1 month apart. HPV, human papillomavirus vaccine, we now have and is recommended. And in fact, women now up to the age of 45 can get this vaccine.
Well, I didn't see that because on the chart it says up to 26 for HPV.
It's a footnote.
Oh, okay. And that's both men
it's not
and
routinely.
women.
Yes,
men and women.
Well, for reasons that I disagree with, what you'll see for men is that up to age 21. And I think they should get it just as women up to age 26. This is not a disease of women. This is a disease of sexually active people.
Okay, got it. And the other thing about Shingrix is that's for people over age 50.
Correct.
Right.
Yes.
And the Shingrix is much more effective than Zostavax.
Yes.
And the Zostavax immunity would wear off over time?
Yeah, you've generally had somewhere between 4 and 7 years protection. This vaccine's been tested out to 9 years with no significant waning of that immunity.
You know, I also found it interesting that when you're an adult, 19 or above, there's 2 pneumococcal vaccines that you should get. There's hepatitis A, there's hepatitis B, there's 2 meningococcal vaccines that you need, and also Haemophilus influenza type B.
So just to make a careful point about that, is that the meningococcal is meant for younger people or people who are in a context where they're at risk. So you and I would not get meningococcal vaccine. But if you were in the laboratory working with this bacteria, or you were going to go to Southwest Asia to the Hajj, then you would be at risk and we would talk about that. But it would not be a routine vaccine for people in their 40s and 50s and 60s.
All right. Yeah, interesting.
And the pneumococcal vaccines, too, if you had a chronic medical condition, we'd give it starting at the age of 18. But otherwise, it's not routinely given until people get to age 65.
Now, who's supposed to keep track of all this?
It's complicated, isn't it?
It is. It's extremely complicated. So, I mean, particularly if you moved and had one physician in one place and then went to a different physician someplace else in the country. I mean, how do you keep this all straight? Because individuals don't do it.
Yeah, Tom, you're exactly right. So we sort of depend on 3 things. 1, people are given an immunization card. 2, they go to the pharmacy sometimes to get, for example, a flu vaccine or a tetanus booster. And 3, the primary care doctor that's giving it. And sometimes, it depends on the state, there are computerized statewide registries that do it. Despite all of that, my most frequent experience is I ask always about vaccines. I don't know. I can't
what you do.
I can't find it in the registry, so I don't really know what they've done. And so oftentimes I find I'm having to give a vaccine, and I'm not really sure, did they get it or did they not get it? But I err on the side of caution.
I think the electronic medical record should help.
It does help.
Don't you?
It definitely does. When patients come here to Mayo Clinic, for example, I can click on a button and I can see every vaccine they've had here.
Now, if people want to look at this table and figure out how many of these they have or have not had, you can go to cdc.gov and search immunizations. And it's an excellent table.
It's
and
very
fairly easy to
patient-friendly.
read. Yeah. And that's a little bit different than it used to be.
Yeah.
A lot better than it used to be. The recommended adult immunization schedule has obviously undergone a major change, a makeover for 2019, and you can see the new schedule by going to cdc.gov and searching immunizations, or talk with your healthcare provider, and hopefully they know what you had or you haven't had. We're with Mayo Clinic vaccine researcher, Dr. Gregory Poland. Time for a short break.
When we come back, we'll get an update on the flu season and hear about a new flu vaccine that is in the works. You're listening to Mayo Clinic Radio on the Mayo Clinic News Network.
One of the other things in regards to flu is a brand new drug, antiviral, that was released in November, so not many people know about it, called Baloxavir or Xofluza. It's a funny name.
We're halfway through. We've got 9 minutes to go.
Boy, 9 minutes go fast.
Just like that.
How is that possible?
Well,
it's literally something I could talk about all day, Tracy.
It is. Absolutely is. And I'm not surprised by it either.
In fact, what I like to say, of all the interviews I've ever done, this is one of them.
It is. It sure is. You got that one, Rick? Put it in your book in there.
When are you going to do an outtakes and show a whole episode of...
Tracy's got some dirt on all of us.
superb as usual.
You ready?
Ready.
Go ahead.
Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McRae.
We are with Mayo Clinic vaccine expert, Dr. Gregory Poland. He's one of the world's experts on vaccines.
And he's right here. Right here with us.
So tell us about the flu season. How did we do this year? And I guess it's really not over yet, huh?
No, it's not over yet, and it's a bad year, Tom.
Really?
Oh, yeah. We went from, in the beginning of the year, to an H1N1, that's a type of influenza, to we are now into an H3N2 season. That's the worst one, and we usually end up with an influenza B tail to the season. So far, it's estimated that about 400,000 Americans have been hospitalized as a result of this. Somewhere around 25,000 Americans have died. This is a bad, rough year. The problem is...
I should just say, for the folks who are listening and say, what did you just say, 25,000 people died? Explain what that encompasses.
What that means are people who had influenza and either died of influenza, which is not as common as dying from the complications of that infection. Pneumonias, they get a heart attack or a stroke triggered by this. They end up in the hospital or the ICU. 90% of those deaths, I should say, are in people 65 and older. You know, I'm over 60. I consider myself healthy. But the fact of the matter is, once you cross that magic threshold, your immune system is weaker and you are at increased risk of complications. We've had, so far in 2019, I think it's 17 children die from influenza. You know, those families are forever changed. I bet if I could talk with them, they would give anything to go back and give that child a flu vaccine. It is recommended in the U.S. for every American aged 6 months and older.
But how did the vaccine work this year? I mean, were you pretty accurate in your prediction?
Yeah, you know, you might remember we talked earlier, and I want to make a careful distinction here. So it's about, depending on the age group you look at, 30 to 50% effective. That doesn't sound too good, does it? But that's because of how they talk about it. By effective, they mean, did you get symptoms of influenza? That's not why we give the vaccine. That's not what the focus should be. We give the vaccine, yes, we hope we prevent symptoms, but to prevent the complications. So I had somebody say, well, I got the flu vaccine and I got the flu. And I said, so it worked. And they said, what do you mean? And I said, you didn't get a complication, you didn't get pneumonia, you're not on a ventilator, you're not in the ICU, you weren't hospitalized, and you didn't die. It worked.
So really, now that's interesting, and something that everybody I don't think understands and everybody should know is that even if you get the flu, if you've had the vaccine, you're less likely to develop a complication.
Absolutely. In fact, the data...
No matter what type of flu you get.
Well, you know, the closer the match to the vaccine, the better. But careful studies done year after year have shown that we prevent about 70 to 90% of deaths, prevent about 70% of the hospitalizations. So these are so-called infection-permissive vaccines. There's not a vaccine I can give you that causes sterility against the virus. Can't happen. It won't happen. That's not how these vaccines are made. What they're made to do is generate an immune response so that you don't have an overwhelming viral replication in your body and that virus overwhelm your ability to resolve or cure itself of that.
And let's mention again the importance for people over the age of 65.
Yes.
There's 2 vaccines that they should get or ask for.
Yeah,
tell us about those.
There are really 3 that are useful for people over the age of 65. And in no particular order, I would characterize them this way. There's the so-called high dose, 4 times what you get in the standard dose. The second, newer one is an adjuvanted vaccine. That is a chemical added to boost the immune system. The third one, for which there's a little less data, is a recombinant vaccine. So this is a flu protein made in caterpillar cells that's harvested and has shown increased efficacy over the standard vaccine that a younger person would get.
See, we have to have you on periodically because the last time you were here, which was not that long ago, we didn't know about number 3 in the caterpillars.
Yeah.
Is that the new one that we referred to in the opening of our script?
No, the newest vaccine that you were talking about, which is a universal vaccine, is not yet licensed. But a lot of work going into the idea, could we create a vaccine where we wouldn't have to give it every year? Influenza virus, the best way to put it is to say it is a promiscuous pseudo-species, meaning in the time we've been talking, trillions of new influenza viruses have been created by nature.
Well, that's why we talk about being a match.
Yeah. Fortunately, most of those cannot replicate, don't go anywhere. But within this season, the virus is mutating and changing. So when this H3N2 virus, which is circulating right now, when it started, it was a very good match with the A Singapore virus that's in the vaccine. In just the last month or two, it has started to mutate so that the vaccine that we have will be slightly less effective as that virus mutates more and more. The other thing that would be worth talking about is a brand new influenza antiviral drug that has been developed. I think it was released in November. The beauty of this is it's one dose, one time, with very high cure rates, very fast resolution to having no symptoms. But here's the kicker. You have to be treated within 48 hours of those symptoms, ideally 24 hours. That's hard to do, but up to 48. After that, probably not effective.
So you have to be paying very close attention to your symptoms.
Know your body.
Mm-hmm. And a lot of people don't.
No, you're right.
So it's a one dose.
One dose.
As opposed to what would we have before? Tamiflu. So how many antivirals are there out there?
Well, from the oral point of view, there are several. There's this new drug, baloxavir. There's Tamiflu. There's zanamivir, which is an inhaled one. There's a set we don't use anymore because of high resistance. And then there's an IV preparation that we give people in the hospital.
Spell that for us, baloxavir.
Baloxvir.
Baloxavir.
Baloxavir.
Okay, baloxavir.
It's like a foreign language, isn't it?
Okay, you have to take it within 24 or 48 hours of the onset of symptoms.
Right.
And that would be fever, aches and pains, headache.
Sore throat, that combination of things. So the typical way that influenza hits is you're feeling fine, and an hour from now, man, you have a fever, you are exhausted, your throat is sore. And then there's some permutations within that.
What about these killer T cells?
Yeah, well, killer T cells are what we hope to generate with something like a universal flu vaccine. So the idea there is to make the vaccine against the part of the virus that we don't see mutation in. So even though one part of it that I've described keeps mutating, the so-called stalk part of it doesn't mutate, and it develops these T cells that can identify and kill the virus.
So when you say universal vaccine, you're talking about a vaccine that would be effective against every type of flu.
That's the idea.
And that you'd only have to take it once, right? Isn't that what you're working on?
We don't know about the once.
Okay.
You might have to get it 2-3 times in your life, but not every season.
All right, so the important thing to know is if you're an adult, there's lots of vaccines that you should get. And it's easy to find out where to get that information. You just go to cdc.gov, type in immunizations, and it'll help you through the list. The only problem is... Yeah, print it off,
stick it on your fridge, you're all set to go.
The other thing I would add is, because people have misperceptions about this, the flu ain't over yet. If you have not gotten your flu vaccine, go get it. This end of the year, I think, is going to be a bad year.
In the spring?
Yes.
Wow.
And if you do get it, within 24 or 48 hours, you get a baloxavir
There
pill.
you go.
Yeah? And when you say, does it just shorten the duration? I mean, it doesn't cure.
It reduces the viral titer very quickly so that the time to resolution of symptoms is very fast, and it prevents complications because of lowering that viral titer.
All right, everything you should know about adult vaccinations and an influenza update. By the way, as Dr. Poland said, a bad season.
And it's not over yet.
No, 400,000 hospitalizations and what did you say, 25,000 deaths?
25,000 deaths so far.
Vaccine expert, infectious disease specialist, Dr. Gregory Poland, thanks so much for being with us.
Pleasure.
Always great to have you.
Thank you.